What's unique or special about working in iCope as an iApt service? So I would say that one of the things that's most special about this service, and I've been here since I qualified and haven't left, and that's because of the way in which I've been line managed and supervised. So I feel as though I've always been nurtured here, and that I'm thought about as a person with experience and skills that I have to bring, and that I can build on those skills and think about where I want to go within the service. So I've been cultivated as a clinician rather than just coming into a service and just being a clinician, seeing lots of patients. So I feel really thought about as a person here, and I think that is quite special to this particular service, and I think other people have said the same.
I definitely agree with you, Chinny. So I've also been in this service for coming up to 9 years now, which is a really long time. And I think one of the main reasons that I'm still here is just the friendliness and kindness of the team and colleagues. The relationships with other clinicians is so lovely. It's such a warm, friendly place to work, and I've always felt really nurtured as well. So yeah, I completely agree. It's a really lovely service to work in.
Absolutely. I think one of the things that stands out as a memory is I remember when I first joined, there was a Christmas do just as I was joining, and the team all came together, and nobody knew me, but they kind of did Secret Santas, and I got a gift on that day, and I felt like that was really special, and it made me think, wow, this is like a really nice place, almost like quite like a family.
Definitely agree. I think of our team as like a family as well. It's really, really lovely place to work.
So how have you been able to use the skills that you have as a clinical or counselling psychologist whilst working in iCope? That's a really good question. I would be thinking that so I think as a clinical psychologist, I have been able to do, so I guess obviously there's the one-to-one therapy side of things, okay, and that's always very interesting, especially I particularly like working with anxiety cases and getting out there and doing things, doing experiments and behaviour experiments with people. But I also think that we've been able to have spaces, reflective spaces actually, and I don't think we in our iApt service we don't just have supervision. There are often group supervisions that have been set up, and that's very special, I think, and allows us to think in a different way and to develop ideas with other clinicians, and also running groups in this service. I think I remember going along to a group's supervision just for groups and actually really thinking about how we run our groups and how not just the functionality but the process, and that felt for me like using my therapy skills in a different way, and it felt really important there.
I would agree. I was thinking one of the things I've most enjoyed working in this service has been building really close relationships with the GPs that refer to us. So we're very embedded in GP practices in iCope, and I spent at least one day a week kind of getting to know a GP practice really well and going along to their practice meeting, and so kind of offering consultation to them and building those relationships has felt really important, alongside offering individual therapy, group therapy, having really lovely spaces to reflect. So we have a complex case meeting where we kind of discuss a case in depth from different perspective every fortnight, and that's definitely been a highlight and developed my thinking in lots of different ways, not just in CBT. So lots of opportunities to work quite creatively and kind of more than just doing lots of one-to-one sessions.
And I think with those group spaces to reflect, they tend to be multidisciplinary. So we've got a counsellor there, we've got, you know, people from potentially psychotherapy service there, and it allows you to really think about your cases beyond just thinking about applying CBT. It's almost about the process behind that too. And I think that's very, very special.
Definitely agree. Whilst working in iCope. So actually, I think one of the things I've loved about working in iCope is just the amount of opportunities to develop in different ways. So when I first started working in the service, kind of I had a big clinical caseload, mainly seeing people one-to-one, and then quite quickly I started to supervise. So first of all, I supervised a psychological wellbeing practitioner, and then I, after I'd been qualified for a few years, I supervised a trainee clinical psychologist. As well as that, I started running a group, so that it was identified in the service at the time that we had clients with some more complex needs, and we set up a DBT group. So I was given the opportunity to train in DBT skills, and I started running a group. And then I was something called the Transitions Champion for our service. So lots of clients coming via CAMS or whose needs kind of needed to be thought about more carefully in our trust, from young person services to adult services, and different teams had champions, and I got to do that for our service, which meant I could go along to some trust-wide meetings and think about young people, and I got some extra training in kind of working with young people. And also I got to train in DIT, which is an IAPT approved model, which is now the main modality I work in. So I feel I've had absolutely loads of opportunities to kind of develop in all sorts of different areas.
I think similarly, one of the things I've really loved is the fact that there is this huge scope for training and development. So I remember in my first 2 years, and I think this is still available for everybody, that you would you'd go on a newly qualified training course, and you would learn about the core skills in CBT, and there's a rotation. So you do like a few months of CBT, 6 months of CBT, then you go on to do 6 months of psychodynamic psychotherapy and learning about that therapy modality. And you'd go on and do other courses, so you could choose to do systemic training as well, and that's all alongside your work within the IAPT service. And I thought that was brilliant. It means you get to meet other people in the secondary care services that are in our borough. And then when you are making those referrals potentially to some of these services, you know what they do and what those models mean. And it really helped me to build on my skills from training, because I started here newly qualified, and so it felt like a good way to sort of consolidate my skills. And my caseload was matched so that I was not seeing the same number of people and also going on this training. So I felt that was really thoughtful and a good way to sort of help me sort of move into the service and start to work and develop as a clinician. And then similar to what you said, Lisa, I've been able to do other training. So I've been on couples therapy training for depression, and I felt that was brilliant. And then I developed a coping with depression group, and ran that for many years within the service. And I feel as though all of the things I've been interested in, I've been able to sort of segue into that with support from the teams and my managers. So I think that that's something I've really enjoyed about my career development, and I've just been able to develop in ways that I'm, go in a direction I'm interested in, but also learn about other models so that I can work out what it is I do like here. And I think that's been really good about working here.
I think that's true. I was just thinking as you were speaking that we've worked alongside each other for years, and we've both had loads of opportunities to develop, but we've done slightly different things according to our personal interests.
Absolutely. Yeah. What would you say to clinical or counselling psychologists thinking about applying for a job in iCope? I would say prepare yourself to end up staying here for longer than you anticipate staying here, because it's such a great place to work. I would also say that maybe think about the things that you really want to develop and make that known within the service, and you'll definitely be nurtured in the way that you need to be here. So yeah.
I agree with the things that Chinny's saying, and I would say if you're looking for a really good opportunity to sort of develop your generic skills as a clinical psychologist, and you enjoy working in adult mental health, you want to be a therapist kind of primarily, but also develop skills in consultation and kind of are interested in developing different modalities of working, then this could be a great job for you.